Hello, and welcome again to another episode on our new series on CYC MD. In this series, we are exploring different specialties and speaking with different professionals in regards to their area of practice. Today, we will be focusing and narrowing on the topic of the heart and heart disease. What causes heart disease? Am I at risk for heart disease or even a heart attack? And of course, you want to stay till the end as we talk about secrets to maintain a healthy heart. With me today, I'd like to welcome Dr. Amgad Makarios. Welcome, doctor.
Thank you, Mary.
Pleasure to have you. Who will be answering many of our questions that we have in regards to the heart. So to start, if you could just be so kind to just tell us a little bit about yourself. Where did you graduate from and how long was your program?
Okay. I actually went to medical school at SUNY Downstate, Brooklyn College, and also Brooklyn College is part of the medical program. Medical school itself was 4 years, but then after that there's residency, which I did in internal medicine, and then I specialized in cardiology, which was another 4 years after that. So pretty much a long way of training.
So total of how many years?
So medical school 4 years, 4 years of residency, and then another 3 years. So, and that's not including undergrad.
Wow, okay. We don't want to count. So where do you work now?
So right now I work part of the North Shore LIJ health system at Nassau University Medical Center.
Mm-hmm. And what's your title?
I am the chairman of the cardiology program there.
Okay, so if I could just ask you, why did you choose to focus on the aspect of cardiology?
So, going through medical school and then residency, I always found cardiology to be one of those fields which always has new studies and trials taking place. So sort of the type of thing where one is always on the cutting edge of treatment, whether it's new medications, new treatments for heart disease, and also the fact that heart disease is the most common cause of death in both men and women in the U.S. So I always found that to be one of the most important things, and I always found it interesting as well that we can really make a difference in a lot of these patients.
Mm-hmm. So what do you say would be most challenging about your job?
One of the most challenging things, I guess, and we're all guilty of this, is that most people actually know what or have an idea of what they can do in terms of preventing heart disease, preventing strokes, and all types of things involved in the field that I practice. However, it's hard to actually maintain a lot of these things, and we'll talk about them, I'm sure, coming up, but whether it's diet or exercise, most people have difficulty actually being conscientious about these things, which can actually prevent them from having heart attacks and strokes, later on in life. And I find, that difficult, including in myself. I'm just as guilty as everybody else. That's one of the most challenging things. And then once people do have heart disease, I find it sometimes challenging also because even those people, after they find out they have heart disease, sometimes don't follow the things that we tell them would be best for them.
Mm-hmm. So do you feel guilty being a cardiologist as you bite into that burger, per se?
I try not to think about it too much, but it is one of the things. We all have to be conscientious about it, and one of the biggest things in my field now is really preventing heart disease before it happens. So that's really the key, but I can't tell you when I go to McDonald's that I think about it that much. But it's really something we should, all joking aside, think about, all the time, because we are hurting ourselves sometimes, if we don't, eat the right thing, do the, right things, exercise, all that.
So overall, what does the field of cardiology encompass?
So cardiology is, or cardiovascular disease, most people usually leave off the cardiovascular. It's basically everything in the circulation of the heart, the circulation of the body. And that includes the central part is the heart, which really pumps the blood throughout the body, through all the blood vessels, the arteries, the capillaries, and the veins throughout the body. So that's what entails the field of what I practice. And basically what I do is I deal with diseases of that system.
So I know many times when patients go to see their doctor and maybe the first thing either the doctor or the nurse, of the doctor, or whoever, they usually take the blood pressure of the patient. And maybe that's one of the first things they do as the doctor gets ready and pulls up the chart of the patient. And, you know, she takes the blood pressure, or he or she takes the blood pressure of the patient and tells them their blood pressure is this and that, and gives them two numbers that, you know, sometimes the patient may know it's good, may not even faze the patient what these numbers mean. So my question to you is, what is normal blood pressure, and what is the difference between the two numbers?
Okay, that's a very good question. The blood pressure gives us a feeling for the pressure, which is the amount of force within the blood vessels that we talked about. So that force is generated by the pump of the body, which is the heart. So we always talk about a higher number. That's sometimes called the systolic number, and that's basically when the heart squeezes. So when the heart squeezes, it generates a certain amount of force within the blood vessels. When the heart relaxes, that's the lower number. That's the diastolic number. So both numbers are important, because if any one of them is elevated, that can cause heart disease, that can cause blockages in the arteries and all those types of things. So we talk about the heart sort of having two sounds, the lub-dub, lub-dub.
Yes.
So the lub is the first one, that's the systolic. Mm-hmm. The dub is the relaxation, which is the part where the heart relaxes. So those are the two, systole and diastole. So when we measure the blood pressure, we use a cuff, we inflate it usually in the arm, and we inflate it to a point which is higher than the upper number, and then we decrease it slowly until we hear with our stethoscope that first beating, which is going to be the higher number, and then we look to hear the lower number disappear. So that's the lower number. So that's how we measure the blood pressure, and again, it's an indication of what is the pressure in the arteries. Now, in terms of numbers, usually in general, 120/80 is a good number, whether you're, a teenager, higher, things like that. The absolute sort of cutoffs are usually changing, again, based on studies that we do to look, what they should be, or if you have other diseases or things like that. So
different
it's
populations,
always, exactly, different populations.
Maybe if you have another diabetes or anything
exactly.
like that.
So if you have diabetes and things like that, you have to be careful, and the numbers might be different. And many years ago we used to say 140/90 was the absolute upper number, but now we're saying even lower, 130/85 or something of that sort. So those numbers, are sort of sometimes changing in terms of our recommendations, but for the most part, the magic number, one magic number that you could use is 120/80.
For 80. Okay. Thank you. So now in regards to, you talked earlier about, the function of the heart. If you want, maybe if you could go into a little bit more depth of the role of the heart, and also what is the normal heart function? Okay.
So as I was mentioning, the heart is really the central pump. Without the heart, the rest of the body doesn't get the oxygenated blood. So the oxygenated blood comes from the lungs, it's oxygenated in the lungs, comes onto the left side of the heart. The left side of the heart is the major pump function of the body. So the main artery that comes out of the heart is the aorta, that supplies blood to the rest of the body, the brain, the legs, fingers, everything. And what happens is the heart beats about 60 to maybe 100 beats per minute, pumping that blood throughout the blood vessels, and that's how all the blood vessels get the oxygen that all the tissues in the body get the oxygen that they need. Now, once the tissues use up the oxygen, the blood comes back to the heart, goes into the lungs, and then it starts to cycle all over again. So that's really, the amount of what happens. Now, if you think about it, the heart is this pump that we sort of take for granted. It's always pumping. Since the second we're born, even before that, it's a muscle, exactly. So it's made up of tissue that is specialized muscle tissue. It has electricity, and it has flow throughout it. So the electrical circuit keeps the heart beating. We talk about people who have pacemakers sometimes. Their electrical circuit doesn't work normally, so they get a pacemaker. But if you think about it, 60 to 100 beats per minute, that's about 2.5 million times, a year. And this is going on for your whole lifetime. So it's probably the most efficient pump you'll ever find. Now, the other thing is the amount of blood that the heart pumps. So the heart pumps there's about 5 liters of blood, give or take, in most human beings that the blood is pumping around. And if you were to calculate it, and this is a fact that I came across, the amount of blood that you pump actually is similar, and the distance that it goes, you pump these 5 liters, about 120,000 miles every day.
Wow.
So 100, that amount of distance is actually, going across the U.S. like 4 times or something of that sort. So again, as you can imagine, it's a large amount of work that the heart does. That's really what the heart does, and it's really amazing, how it does it.
Wow, that's a great analogy too that you
Yep.
just. Since we're talking about normal values, I know many of us, even at a young age, we have a problem with cholesterol, and again, some of us. We know that there's something that's HDL, we know that there's LDL, we know that there's triglycerides, and all these components make up cholesterol. But then again, what is the good cholesterol, what is bad cholesterol, and what are the normal values?
So that's a very good question that some people actually get confused about, because some people think, oh, cholesterol is bad, so what do you mean by good cholesterol and bad? So the cholesterol particle is a form of storing, cholesterol, and there are different particles in the body. We talk about different things. We talk about the total cholesterol, which includes all the different forms of the cholesterol. And then there are 2 plus types of cholesterol that are stored. One is the HDL. This is the so-called good cholesterol.
So HDL is good.
Is good. And the other is the LDL, okay? And that's the bad cholesterol.
Okay.
And that makes up the total. So if you add that, plus there's also the triglycerides part. Triglycerides are just pure fats in the blood. Cholesterol is a storage form of fat, okay? So sort of try to keep that in mind. Now, the good cholesterol we want to raise as much as possible, because what we found in studies that have been done is the good cholesterol actually decreases your risk of heart attack and things of that sort. And the particles themselves are actually different sizes than the bad cholesterol, which is also a different size. The bad cholesterol gets into the arteries and actually clogs them up, and that's how we develop, heart attacks and strokes and things like that. So the more we can push up the good cholesterol, the better off we are. And in terms of numbers, again, different populations should have different numbers, but your total cholesterol should not be greater than 200 usually. Some people even say 160. So I know some people say, again, long time ago we used to say 200, is fine. Up to 200 is fine. Now we're decreasing the numbers even more because, again, major trials are done, and we found that the lower you bring it, the better. And your HDL, just for rule of thumb, should be above 40. So anything greater than 40 is actually good. Here we're talking about a higher number as opposed to a lower number. The LDL cholesterol should be less than 130 or 100. So about 30 points less than your total cholesterol should be your LDL cholesterol. Now, if you have diabetes or heart disease or other things, then your LDL should be even less than 70, some people say. So again, it has to do with your risk factors, and things of that sort.
And being a pharmacist, I'm sure there's medications that are given, and probably we could say maybe statins are the...
Right. So statins are the medications that most people are familiar with, and what we talk about with the statins is they actually work to decrease the absorption of cholesterol from the foods we eat. And by doing that, they adjust the, we call it the lipid profile, the amount of fat in your blood. And again, by doing that, our intent is to decrease the bad cholesterol and hopefully increase the good cholesterol in the blood.
Okay, so shifting gears back to the heart, what are causes of heart disease?
Okay, so we've touched upon some of them already, but really when you come down to the main issue, when we talk about heart disease, it has to do with plaques building up in the arteries and causing blockages. Mm-hmm. So if you get a blockage, we were talking about all the blood with the oxygen getting to all the blood vessels. When you cause a blockage, that blood doesn't get to where it has to be, and those tissues will then suffer. They won't get enough oxygen, and they won't get enough of the nutrients that they need for their function. So one of those things is a heart attack. And when we talk about a heart attack, it means the amount of blood getting to the heart is actually not oxygenated enough. So as you can imagine, the heart, which supplies all of this blood for the rest of the body, is probably one of the most important tissues to get that oxygenated blood. So before we get to those different types, let's just talk about the risk factors. Why do we get these plaques? These plaques, again, have to do with the cholesterol that we have in the blood. So the more cholesterol, the more risk there is of getting buildup of these plaques in the arteries. The higher your blood pressure damages the wall of the artery and causes these plaques to build up in those areas. If you have diabetes, that also makes the cholesterols in the blood not in a good level also. If you smoke, that causes damage to the wall of the artery as well. If you drink alcohol, that can directly damage the wall of the heart itself. If you use drugs, for example, some drugs will cause the heart to speed up, like cocaine, for example, will cause the heart to speed up too much, and then you won't get the oxygenated blood that you need. So all these things can, and of course there are many other factors that we're, learning every day, but those are really the main, risk factors. And another thing that obviously one can't change is family history. If you have a family history of a mother, father, brother, sister who've had heart disease or a heart attack or something of that sort, then you're more at risk, because we found that some heart disease, or if your cholesterol is abnormal, can run in families as well. So it's hereditary, and it's something that you can get. So those are really, the major risk factors. The other thing, once you have those risk factors, or that there's damage to, the heart, and the blood supply is compromised, meaning you don't get enough blood to the different tissues, you can have a heart attack, and that's where there's a plaque that builds up in the arteries of the heart. Another thing we talk about is a stroke, and a stroke is really a brain attack. It's like a heart attack. The only difference is now there's plaque building up in the arteries of the brain, so the brain doesn't get the amount of oxygen that it needs. So those are really, if you get blood clots in different areas, you can have problems with your lower extremity. You can have different types of vascular disease that can develop. So those are really the different types of problems you can get.
Thank you so much.
Thank you very much.
We hope you enjoyed our episode today with Dr. Emged Makarios. Thank you so much again.
Thank you.
You gave us a lot of information, and just remember, it's never too late to stop a bad habit, whether it's smoking, whether it's alcohol, and to get right on board with all the advice and recommendations that Dr. Makarios just gave us at the end. A healthy heart allows for a healthy body, allows for a healthy mind. I hope you enjoyed our episode. Until next time, God bless.